Guten Morgen. Wir haben 3:50
Good morning, my dears. It's 3:50 a.m. I just got a call from the transplant center. For the first time, I've been offered a lung. I'm just trembling with excitement. It must be plain to see. Like I said, I'm really excited. They're going to call me back shortly to discuss how I'm to be transported and other details. I just wanted to let you know I have my offer. I'm infinitely grateful. See you later. I'm in the ambulance now. We're about to leave. I've calmed down a bit. I have a chance to get a new life, a second life. They have a compatible lung. That means I'm getting a transplant today. When you're in the prep room, it hits you. Now it's time. Of course, it occurs to you that you could die during the operation. But then I knew, as macabre as it sounds, that I also have a donor card. And my kidneys weren't bad. And I think my heart could possibly still be used. I don't know. I'd be willing to pass that on to someone else. When I woke up from the anesthesia, the first breath was such a pleasure, to be able to breathe deeply and strongly. I was still on a ventilator, but it was such a pleasure to be able to breathe. It was incredible. I cried at first, out of joy, pure joy at being able to breathe. It was, I can't put it any other way. It's phenomenal to now have this chance to live on because someone else decided to donate their organ. And now my life can continue with my husband, my family, my friends, my loved ones. I don't know how much time I would have had left, but it wouldn't have been much. I know that intuitively. Many, many years ago, over 30 years ago, I had pneumonia. And after that, I developed pulmonary fibrosis. That's a scarring of the lung tissue. It means it gets harder and harder to breathe in. You can't take in oxygen.
Hello, Miss Bopp. Good afternoon.
Hello.
How are you?
Fine.
Everything okay so far? Are you managing all right? It's been about a week since we did the transplant, right?
Yes, exactly.
Okay, great. How are you getting along with the lung floats? Have you been managing to practice a bit?
Yes, even in the middle of the night.
Oh, great. All right. Bye for now.
Bye. It's still difficult to cough up phlegm. I still have to learn that. It'll take a few weeks, but I can keep it. It's mine. The next question is, will I make it through the first year? Because that's the hardest thing of all. I made it through the surgery, but the rest remains to be seen. I have to work on that now. Every single day, every single second.
Ich
On the ward round this morning, the doctor told me I had a little water in my lungs, about 400 milliliters, and that I'd need to have a puncture. But what he took out wasn't 400 milliliters. It was pretty much a liter. That was a little worrying, of course.
Great. Last time you only managed 2 floats. This time you've already managed 2.5. Take a breath. Breathe in and out through your nose. Try to let the breath flow nicely into your belly. Any pain at the moment?
A little bit. I'm waiting for painkillers.
Good afternoon, Miss Bopp. How are you today?
I'm feeling very good.
Then we've done a good job.
Excellent work.
We did the transplant 10 days ago. Then I went on holiday, and now I've come back and you're glowing.
Yes, I'm really grateful.
We're satisfied. So far, everything seems to be going well. Yes, because the underlying issue was fibrosis. That means the thorax, the chest cavity, was relatively small and couldn't easily accommodate a new pair of lungs. That's all because of the fibrosis. So transplants can be tricky for these types of patients. But this one went well.
Bij patiënten met een fibrose die transplantatie. Maar dat is goed geklapt.
The breathing is going well, of course. Coughing up phlegm is still hard, but like they say, the lungs still have to learn. But breathing deeply works really well. The thank you pillar was a very important destination for me. It was a goal I had. I wanted to go there after the transplant. When you put your hand on the hand that's there, you can actually hear other patients who've had various different organ transplants. You can hear the individual stories of these people saying thank you for their organs.
Hello, I'm Kerstin, and I had a lung transplant almost 2.5 years ago. I would just like to take this opportunity to say thank you to my donor and his family, because without him, it would not have been possible for me to continue living. Thank you very much.
I think it's such a nice idea that you can hear about other stories here. And I was so impressed that someone has had their double transplant for 18 years. That's something special. Hello, my dears. I'm going to take you with me as I climb the stairs. I imagine it's a bit strange for you because climbing stairs is something you can do without thinking about it. For me, it's a bit strenuous at the moment. So now you can see the emergency room. And I made it. I'm at the top. Done. This is the most strenuous thing I'm doing at the moment. I've improved quite a lot. When you think that I started with 3 minutes on the bike here, and now I can do 15 minutes, So it's quite an achievement to get there within 3 weeks. I'm very proud. Rehab wasn't exactly easy, especially right after the surgery. First of all, you have fresh scars and everything still hurts. And then I also had side effects from the medication. I had to push through. Hello.
Hello, Miss Bopp. How are you?
Not so good today, I'm afraid. I'm having a few problems, but let's give it a try anyway.
Do you feel ready?
I feel ready. Wow, I'm feeling it.
2 more and you're done. That's the last one.
We have to pull the brakes sometimes to make sure it doesn't take a turn in the wrong direction. But she's always motivated, friendly, always there with a smile, despite the mask.
You learn to breathe differently again, because when I was on oxygen, I learned pursed lip breathing. And here you get rid of that habit again. And the therapists keep reminding you to breathe properly again, completely normally. They pay very, very close attention to that. This breathing therapy is especially important. I'm really happy and also quite excited, I have to say. It's crazy finally coming home after so many weeks, and I'm looking forward to the pre-Christmas period. I want to try to bake some cookies if I'm up to it. Maybe I can even do that with my grandchildren. It would be a dream come true. What else can I say? Hello, my darling. Hello, Uwe.
Ich freue mich dermaßen. Hallo, mein Großer.
Komm zurück.
Hast du Angst vor mir?
Are you afraid of me? You can put on a mask too.
Mir geht's jetzt richtig gut und viel
I'm
besser.
feeling really good now, much, much better. My heart is just full to the brim. So happy.
Bin wieder
I'm
zu
back
Hause.
home.
Wir sind tatsächlich jetzt in meinem Zuhause.
We are actually at my home now,
Das war für mich in einem
in a room
Zimmer.
that my family has prepared, especially for me.
Mein Sohn war richtig
My
super
son worked
fleißig.
really hard, along with a bunch of friends, to prepare the room so I can be here for the next few weeks and months,
Damit ich einfach
so I can
gesund
stay
bleiben kann,
healthy
ein bisschen
and
gesund
quarantine.
kann, falls irgendwelche Infekte irgendwo sind oder
Because the
mein
first
Magen
few
oder
days
dass
are
man da
really
vorsichtig sein
critical,
muss.
and you have
Und
to
die
be
ersten
very,
Tage
very
sind
careful.
kritisch.
And
Und
I
da muss
am
man
being
richtig,
very
richtig
careful.
doll aufpassen und ich bin vorsichtig. Also ich habe mich schon gefreut, nach Hause
Of course,
zu
I
kommen,
was really
meine
looking
Familie
forward
zu
to coming
sehen.
home to see my family. And then I came down to reality, so to speak. The side effects of the medication kicked in, and then unfortunately, my blood values weren't so good. I had to try to cope at first, and I just rested a lot. I was very tired. My heart wasn't cooperating. I was basically unable to do anything. All that progress went down the drain.
Moin, mein Schatz. Moin, Mami. Oh, ich freue mich so. Ich freue mich auch. Wie geht's dir
How are you
heute?
today?
Pretty good.
That she's regained her quality of life. That's very nice to see. She's doing more around the house again, little things. It's easier to talk to her on the phone. Her sentences, she's speaking with more energy again. She's doing more of the things that make her happy.
We're going to visit someone I met in rehab. I'm a little torn. Because on the one hand, I'm really looking forward to seeing Sascha again, but on the other hand, Sascha isn't doing so well. And of course, I'm wondering how we can help him a little. I mean, he already has someone who takes care of him, but still he lives alone and has to make the big decisions all on his own. And it can be very difficult if you don't have the kind of support system that I have. Hello, Sascha. So nice to see you.
So nice. So nice.
So schön. Nach so langer Zeit, gerne.
Sascha has lost a lot of weight, gradually over time, but I know he needs to gain weight. He's trying very hard and just has to make sure he gains some fat and muscle so he can make it onto the waiting list.
You look so good. You've totally changed.
Yes. How are things going for you right now?
I'm not on the waiting list at the moment and have to wait and see. I have to gain some weight first. Last year I was in Gießen and was supposed to be on the list. And then they examined me and said that based on how I look now, I would have to gain at least 10 kilos. I wasn't going to make it on the list. I cried. Everything collapsed. All the hopes you have. It all disappears. From one moment to the next. Throwing in the towel, as they say. It's a thought I often have. When you're hooked up to a tube 24/7, that thought comes up at some point. And at some point it comes up more and more. But still, I'll never give up. Hope is the last thing to die. I don't want to do anything. I just want to breathe properly, like every other normal person. I can't do that. I only know that when I lie here at night, when I wake up, I know I'm still alive, because I'm breathing really calmly. At night, that's the only time it's possible for me. But as soon as there's even a little strain, even talking now, it's exhausting.
Yes, I know the feeling very well. I had it for 5.5 years. You're very restricted, and you know that when the oxygen runs out, you don't have much time. You need to refill it right away. It's very hard. I had a situation years ago where I almost died because there wasn't enough oxygen. It was empty. I'm glad I didn't suffer any brain damage from it.
All my social contacts have fallen away because of the illness. They're all gone. There's nothing. Even the friends who complained all the time don't even call anymore. Where I see myself now, I see myself with a transplant and on vacation again somewhere. Of course, that's important.
Let's hope it works out.
Yes, I hope so too. I hope so too.
That's why I brought cake.
Exactly.
Okay, Sascha, here we go.
Good cake. Thank you.
Don't give up.
Take good care of yourself.
And write down what you eat. That's important. If things get tough, call me.
Yes, I promise. I'll do that. Yeah.
Also mach's gut.
First of all, seeing him again after such a long time, that was lovely. It was wonderful. And of course, it clearly reaffirms our friendship. It was also important for me to see that he's not giving up, and that I was able to give him a little something. That's really important. It's especially important in a friendship, this give and take. And that's something that actually works. It's really nice, and it's fun. Now I can do a bit more. It takes a lot of energy. Everything's very, very slow, and of course sometimes I tremble. But little things like adding up a few receipts, that's a success. You would think it's a 5-minute job. For me, it's actually a day's work. Doing something like that once a day is quite good. It takes a long time, but I get it done. With the family, we try to protect each other. When we're in a room together, one of us wears a mask. Yes, the colors are great. We have really great colors. It's something really important for me, so that I don't catch a cold or get inflammation or something. And it's the same with eating. I usually leave the group so I can eat freely. I eat here in the living room. Hubert brings it to me.
Here comes lunch.
Great. And then I sit here and eat alone while the others are in the kitchen.
I'm happy that I can take care of her. She just needs to eat more. She's so thin. She's lost so much weight because she couldn't eat anything the whole time. That there will be so much to deal with afterwards. She didn't think about that her organs wouldn't work properly and blood wouldn't form. But it's all part of it. It wasn't simply an appendix operation.
My husband suffered a lot. He's not the type to show his feelings. He keeps it all inside. And I think he suffered a lot when I was so ill before the transplant. Those were a really tough few weeks. And he saw me getting weaker and weaker. He was afraid of losing me. So it wasn't easy during that time.
So you want a tattoo?
Yes, a very specific one.
I just typed in organ donor.
You see, most people have it on their forearm because that's where doctors look first.
That's also very nice. Something's growing, like a new life.
I find the concept of taking and not giving difficult. When you need an organ, everyone wants one because they want to get healthy. Whether it's a kidney, heart, skin, whatever. But when it comes to being an organ donor, many people don't realize how important it is. I've been an organ donor since I was 18. And I could imagine the tattoo being on my forearm because that's where they take blood or measure blood pressure. That's very important. It's very visible, and they can look specifically for the organ donor card. It makes it much faster when they already know that the person is an organ donor. That's what the tattoo represents.
That's a very nice idea, Mom.
Should it be bigger or smaller?
I think I'd make it smaller. At almost 60 years old, you can still decide to get a tattoo. Mom's so young at heart. She's an organ donor and wears it with pride. And the tattoo suits her. It reflects her personality. It fits her well.
Now I can breathe again, without a tube, without a machine. It's uplifting. It's just fantastic. Yes, it's difficult. It's not easy. You work on it day by day.
I found myself a good wife who knows how to fight. I'm not the fighter she is. A fight like the one she went through, I don't have that kind of willpower.
So, my dears, it's been 3 months since I got my new lung. Remember when I got the call? You know how excited I was. It was crazy. And then I got the lung, and I still have it. It's not easy, but I'm not giving up. We'll keep up the fight. And I wanted to tell you that I'm doing well. My lungs are doing well, and I'm just happy that I have a future with my family, with my friends. And I'm looking forward to summer. I just wanted to let you know that. So, see you soon.
Wir sehen uns.